Hello everyone, today we are going to learn acute tetanus. Etiology. Tetanus is a specific infection often associated with trauma, except that it may occur after various traumas. It may also occur in lying in women and newborn in unclear condition of childbirth. The pathogen is Clostridium tetani, obligate, anaerobic, and positive in gram station. It usually exists in the intestinal tracts of human and animals and is excreted with feces and distributed in nature in the state of spore, especially in soil. In case of trauma, Clostridium tetani can contaminate deep tissues such as cecum, trauma, and deep stab wound. If the external opening of the trauma is small and the trauma is filled with necrotic tissue, blood clot, or too tight filling ischemia, and anoxic environment suitable for the growth and propagation of the bacteria is formed. If an aerobic infection is present at the same time, the latter will consume the oxygen remaining in the trauma, making the disease more likely to occur. Pathophysiology. The tetanus bacillus, Clostridium tetani, is highly resistant to the environment and is resistant to boiling. The pathogenic factor is the oxytocin. It products mainly the tetanus. The thallus and exotoxin do not cause significant pathological changes locally. However, tetanospasm is observed into the spinal cord, brain stem, and so on, is combined with synapses connecting nerve cells to inhibit the release of inhibitory transmission medium by synapses. Motor neurons increase their excitability due to loss of central inhibition, resulting in random muscle tones and spasm. Tetanasium can also block the inhibition from the spinal cord to the sympathetic nerve, which causes the excessive excitement of sympathetic nerve, blood pressure raise, quick increase of heart rate, body temperature raise, spontaneous perspiration, etc. Clinical manifestations. Generally, there is an incubation period, usually about 7 days, and few patients may develop the disease 1 to 2 days after injury. The shorter the incubation period, the worse the prognosis. The precursory symptoms include general weakness, dizziness, headache, masticatory atonia, local muscular tone, pain, hyperreflexia, etc. And the typical symptom is the paroxysmal spasm based on muscle tones contraction. Usually the first affected muscle group is masticatory muscle, followed by histrionic muscle, neck, back, abdominal, and limb muscles, and finally diaphragm muscle. The corresponding signs are difficulty in opening mouth, frown, chin contraction, sardonic features, neck stiffness, and head tilt. When the back and abdominal muscles contract simultaneously because the back muscle group is more powerful, the torso is thus bent into a bow. Opisthotonus or pleurototonus is formed in combination with such spasm postures as bends of neck and limbs, bends of elbow, and semi-clench of fist. After the diaphragm muscle is affected, the face and lip are blue and purple during onset. It is difficult to respire and apnea may occur. The above-mentioned onset may be induced by light stimulation, such as light, sound, contact, and water drinking. It is often serious in case of different interval lengths and frequent onsets. During onset, the patient has a conscious mind and a painful looking, and the duration of each onset varies from a few seconds to a few minutes. Intense muscle spasm can cause muscle rupture and even fracture. The spasm of the bladder sphincter can cause urine retention. Persistent spasm of the respiratory and diaphragm muscles causes respiratory arrest. The major causes of death include asphyxia, heart failure, or pulmonary complications. The course of disease is generally 3 to 4 weeks. If no special complications occur after active treatment, the degree of onset can be gradually reduced. The average remission period is about 1 week every one. However, muscle tones and hyperphagia can last for a period of time. There may also be some mental symptoms during recovery, such as hallucinations, speed disturbance, and disorder of action, but most of them can recover automatically. In few patients, only persistent stiffness of the injured area may be present, which may last for several weeks or months with good prognosis. When a newborn suffers from this disease, the symptom is not typically because the muscle is weak. The manifestations are the newborn is unable to carry or unable to cry and suck milk, with less actively and weak or difficult breathing. Diagnosis and differential diagnosis. It is difficult to diagnose tetanus by laboratory examination. It is maybe normal in cerebrospinal fluid examination, and it is difficult to find the pathogen by wound anaerobic bacteria culture. However, the symptoms of tetanus are relatively typical, and its diagnosis is mainly based on the clinical manifestations with any trauma history, regardless of the size of the wound and depth. This disease should be considered in case of muscle tones, pain, and difficulty in opening mouth, neck stiffness, and hyperphagia after injury. It should be differentiated with the following disease. Purulent malignance. There are such symptoms as opisthotones and neck stiffness, but not clonic spasm occurs. There are severe headache, high fever, projectile vomiting, and unclear mind sometimes. Cerebrospinal fluid examination shows increased pressure, increased white blood cell count, etc. Rabies with a history of being bitten by mad dogs or cats. The main symptoms is the convulsion of swallowing muscle. The patient cannot drink water and produces a large number of saliva. When the patient hears the water sound or sees water, the spasm of swallowing muscle occurs immediately. Others, such as temporomandibular arteries and hysteria. Prevention. Tetanus is a preventable disease since Clostridium tetani is an anaerobic and anoxic environment is required for its growth and reproduction. Therefore, it is an important measure to prevent tetanus by thoroughly debridement and improving local circulation in early period after trauma. To produce more stable immunity by artificial immunity is another important preventive measure. Tetanus toxoid antigen injection is adopted for active immunity to enable the human body to produce antibodies to achieve the purpose of immunity. In the current plan, immunity often includes the inoculation of tetanus vaccine. Method of passive immunity. The patients who did not receive automatic immunity before the injury should be given tetanus antitoxin subcutaneously as early as possible, because there is an incubation period for the onset of tetanus. Early injection plays a preventive effect, but its effect is short. The effective period is about 10 days. Therefore, patients with deep trauma and potential anaerobic infection can be injected once more after 1 week. Antitoxin is susceptible to allergic reactions, and an intradermal sensitivity test must be done before injection. In case of any allergic reaction, it should be injected as per the desensitization method. At present, the best passive immunity is intramuscular injection of human tetanus immunoglobulin. TIG may be retained in the body for 4 to 5 weeks after one injection, and its immunity efficacy is 10 times of that of tetanus antitoxin treatment. Tetanus is an extremely serious disease with a high mortality rate, especially for newborns and drug addicts. So active comprehensive treatment measures should be taken, including elimination of toxic sources, neutralization of free toxins, control and release of spasm, maintenance of respiratory tract patency, and prevention and treatment of complications. Wound treatment. If a wound can be found, necrotic tissues remain in the wound and the drainage is not smooth, the wound should be treated for complete drainage under good anesthesia and spasm control after antitoxin serum treatment, and the local part can be washed with 3% hydrogen peroxide solution. Some wounds appear to have healed and should be carefully examined for sinus or dead species. Application of antibiotic is aimed to neutralize free toxins. Therefore, it is only effective in the early stage, which is not effective after the toxins have combined with nerve tissues, which is given by intramuscular injection or intravenous perfusion respectively. For intravenous perfusion, the antibiotic should be diluted in 5% glucose solution and perfused slowly. An intradermal allergy test should be performed prior to application. Continuous application or increased dosage does not make sense and is susceptible to allergic reactions and serum disease. At present, it is recommended to apply TIG, which is effective in early application. It should be noted that the onset of tetanus does not ensure immunity to tetanus. 0.5 ml of tetanus toxoid should be injected. and a basic inoculation should be completed 1 month after the diagnosis of tetanus. After admission, the patient should live in an isolation room to avoid such stimulation as light and sounds. It is required to avoid disturbing the patient. According to conditions, sedative and antispasmodic drugs may be used alternatively to reduce spasm and pain in the patient. The available drugs are chloral hydrate, phenobarbital, sodium diazepam, etc. In a severe case, number 1, cocktail lytic can be used, but it is contraindicated in case of hypovolemia. If spasms occur frequently and are not easily to control, thiopental sodium can be used. However, it is required to be aware of laryngospasm and respiratory depression, and it is safe for the patient with tracheotomy done. As for tetanus of newborn, sedative and antispasmodic drugs should be used carefully, and lobeline and nectamide can be used as appropriate. Pay attention to prevention and treatment of complications. Main complications occur in the respiratory tract, such as dysphagia, atelectasis, and pulmonary infection. It is required to prevent the patient from falling off the bed, fracture, tongue biting, etc. For severe patients with frequent convulsions uncontrollable by drugs, tracheotomy should be performed as early as possible to improve aeration, and respiratory tract secretions should be cleared, and artificial assisted breathing should be performed if necessary. The hyperbaric oxygen chamber can be used for adjuvant treatment. For patients with tracheotomy done, attention should be paid to respiratory tract management, including airway optimization, wetting, washing, etc. The patient should regularly turn over and pat the back to facilitate the discharge of phlegm and prevent pressure sore. If necessary, special personnel should be assigned for nursing to prevent accidents. Strict aseptic technology should be taken to prevent cross-infection. For patients complicated with lung infection, antibiotics should be selected according to the pathogen type. There are a lot of daily heat consumption and water loss as the patient are constantly convulsing, sweating, etc. Therefore, great attention should be paid to nutrition, high calorie, high protein, and high vitamins, supplementations, and adjustment of water and electrolyte balance, if necessary, nasogastric tube feeding, and even central venous parenteral nutrition (CVTPN) can be used. Antibiotic treatment. Penicillin is the first choice with the dosage of thousands, with intramuscular injection once every 4 to 6 hours, or with high-dose intravenous drip, which can inhibit Clostridium tetani. Metronidazole may be given at 2.5 grams per day with oral administration or intravenous drip in several times. In case of mixed infection in the wound, corresponding antibacterial agents should be used. That's all for today. Thanks.